This sounds bad, right? It can hurt. You can get an infection. You can get allergies to it. So why are we doing it?
Why are we doing it? Indeed. Progesterone in oil is, by all accounts, the worst. I've spoken with hundreds of people who have taken it, and I've yet to speak to someone who didn't think it was the worst of their injections. Well, today we're going to get to the bottom of it. No pun intended. We're going to talk about why progesterone in oil is the way it is, and we're going to do it with the help of an expert.
Hi, I'm Tom Hannum. I'm the owner and medical director of Hannum Fertility in Toronto, Canada.
Before we dive in, I just ask that you like and subscribe, and if you want to talk to your employer about bringing fertility coverage to your workplace, we have resources for you at progeny.com/talktohr. All right, let's dive in. Most of the other medications are injected with a tiny needle in the abdomen, and lots of medications in general are pills. Is it really necessary to inject progesterone in oil the way they have many patients do for things like IVF?
You can take an injection. You can take tablets. Those same tablets can be taken vaginally. There's vaginal absorption, and there's actually products that are made specifically for vaginal absorption. So because there's all these alternatives, then what's up with this old school injection thing? Because I want to be clear, the injections are not great. They're not what we want anyone to have to endure. The injections have to go intramuscular, not into the fat pad. They have to go into the muscle. They can hurt because it's in an oil, so the progesterone dissolves into you, but that means there's a little pocket of oil. There could be an infection that comes from that. Your body can develop an allergic reaction to the oil.
Okay, so he's saying that there are other ways to do this, and that doctors do understand, but there is more to the story.
This sounds bad, right? It can hurt. You can get an infection. You can get allergies to it. So why are we doing it? It's because it's so reliable. For all those problems I just described, it's actually the best way to deliver progesterone. If you take progesterone orally, then the first thing that happens is it gets broken down by your liver. So some of it will make it to the uterus, but not as much as you would think. So that's why it makes sense to take it vaginally. When you take it vaginally, it immediately gets absorbed and goes straight to the uterus because the uterus is right there, which sounds perfect. But everyone's vaginal mucosa is different, and actually the progesterone, these products, that it can irritate things. So the truth is there's actually quite a variable amount of absorption even when things are taken vaginally. From your experience as a patient, it'll be hard to know because you'll put it up inside and then some hours later it'll fall back, the residual stuff will fall back out and you're like, I don't know, did I get my progesterone absorbed? And the clinic will say, yes, probably, maybe. But you know when it's always absorbed is when you take progesterone oil. It's the most reliable way. Even that's not perfect. Unfortunately, some people will accidentally inject it into a fat pad, so the progesterone levels are not so high then either. But generally, most of the time, it's just so good we can measure it in your bloodstream.
So it comes down to efficacy. Sure, pills and suppositories are easier, but what's the point if they don't do the job? Dr. Hannum did want to add one important piece to this.
If you are taking progesterone oil, you've been encouraged to do it, and you're like starting to realize that you can't stand this and you don't want to do it, one thing you could do is work with your clinical team and find out what your progesterone levels are while you're taking progesterone oil and when you're not. And if you're targeting that 30 to 80 level, maybe you'd be able to modify the dosing that's right for you. Because I'll close with this. You do want to be careful with progesterone oil. You don't want to take any more than you need. Those pockets of oil that develop and when you inject them, that can be a problem. The allergy thing is real. So none of us want you to have to take any more than you strictly need of this ultimately very effective delivery mechanism. And that's why progesterone oil.
It's an inconvenient shot, to say the least. If you're worried about it, we have some resources for you. We have a few videos about this topic on our YouTube channel. We'll link to them here. And remember, if you're concerned about anything when it comes to your health and your treatment, your very best resource is your doctor. Never hesitate to bring any of these issues to your physician. Thank you for taking the time to watch this video. If you like hearing from the world's best doctors, please leave a like and subscribe to the channel. And if you want to learn more about Progeny, visit progeny.com/education. Finally, if you want to learn about how you can help bring fertility benefits to your workplace, check out our resources at progeny.com/talktohr.